are listening to the AOTA podcast. Here is your host, Matt Brandenburg.
Our presenting sponsor for the AOTA podcast is New York University Steinhardt's Department of Occupational Therapy. All right. Today we are joined by DeOnna Clark, Beth Johnson, and Melissa Tilton. Thank all of you for being on the show today to share your knowledge and expertise.
Thank you for having us.
Yeah, we're excited to be here.
Of course. I'm excited too. I'm excited to discuss the emotional PPE project. And I wanted to start by asking each of you three to introduce yourself to our listeners. If you could share your name, maybe a quick snapshot of your professional background, and really getting at what motivated you to focus a portion of your own scholarship and effort on burnout and compassion fatigue within our profession.
I'm Melissa Tilton. I'm an occupational therapy assistant, Matt. I've been an OTA for over 30 years, and I do work at AOTA. I'm the director of governance. And before I joined the AOTA team as staff, I was a volunteer for many things, but my entire career has been as a multi-site manager in skilled nursing. And so for me, this topic, and in particular, the emotional PPE project, was really personal, as I was somebody who utilized the services to support all of my staff as we were going through COVID. I was lost. I was struggling. I was emotionally fried and burnt out and didn't know what to do when my teammates and those who were on my team would call me again and say, another person died, another person passed. Oh, Melissa, your favorite patient passed. And to have them have to experience that. And then I experienced it myself as well in the clinic. And so I was looking for services for myself and my team. And I happened to come upon the emotional PPE project. I became somebody who utilized the services. And then as I transitioned into utilizing my own health insurance, I joined as a board director. And that's where I got to meet DeOnna, which was really cool to see another OT practitioner who is so passionate about this topic. And I'll let DeOnna tell you a little bit about herself and her engagement in this area.
Yeah, awesome. Thank you, Melissa. And I'm just so excited to be here today. I think our discussion will be so valuable for our community. My name is DeOnna Clark, and I am an occupational therapist. I have been so for about 9.5 years and have just had a wonderful time practicing in a variety of areas, but most notably in acute care. I love acute care. I love hospital work, and even more specifically, critical care. My most recent clinical endeavors, I worked on the medical ICU and CVICU, all through COVID, actually. So similar to Melissa, I had my own experiences with compassion fatigue and burnout in their own rights. And it really developed into a passion because it was my story, and I saw that it was a story of many of those around me. And I just wanted to speak out about it. And so I did, and I ended up pursuing my doctorate in public health to really continue the conversation and the research on what it takes for clinicians to be well and just to be emotionally healthy and mentally healthy and even physically healthy. So through that process, I too discovered the emotional PPE project and have just been really excited to work with them as a board director, similar to Melissa, and really just continue the work on what it takes to dismantle barriers that healthcare providers have to seeking help. So excited to chat more about that. And again, excited to be here.
Thank you. Thank you both for those introductions. Beth, how about you?
My name is Beth, and I am an occupational therapist. I've been practicing since 2007. I started in skilled nursing and was in skilled nursing for about 7 years. During that time, I was experiencing a lot of the things that I now know to be compassion fatigue and burnout, but I didn't know what it was then. I didn't know how to define it or how to help anybody with it or even help myself with it. After that 7 years in skilled nursing, I started in academia. I was a program director for about 6.5 years. And during that time, I developed and taught all of the mental health courses. And so I developed a passion for mental health. Ended up going on to obtain my post-professional occupational therapy doctorate. And as my capstone project, I did a continuing education course for OT professionals who are dealing with compassion fatigue. And I've just continued that research with a colleague of mine at St. Catherine's University where I'm working. She and I are doing compassion fatigue research on how it impacts specifically OTs and OTAs in academia. This is just a passion area for me because I am so excited about bringing attention to this very important topic, and I feel like sometimes underserved population in the OT practitioners that deal with this daily and don't know how to help themselves or help each other. So thank you for having us.
Yeah, absolutely. It's my pleasure. I've been looking forward to learning from each of you. And I want to thank each of you for your efforts in this area of compassion fatigue and burnout within our profession. Why do you feel it's so important for occupational therapy professionals to understand compassion fatigue and burnout?
I feel like without an understanding of what compassion fatigue and burnout is, we as practitioners can't be as effective for our clients. I don't know if you've ever heard the saying that in order to pour into someone else's bucket, you've got to have something in yours. And I think that rings true for this. If we're not taking care of ourselves, if we're not recognizing what these issues are that we're having and how to fix them or how to cope with them, or maybe even how to prevent them, how to establish compassion satisfaction before you deal with the compassion fatigue or burnout. Having all of those things makes us more effective practitioners.
Yeah, no, I love what Beth just shared. And I'd love to add to that by saying, when we look at the direction of our profession as occupational therapy practitioners, we add so much value from a holistic perspective. When we're talking about our patients, whether it be in a clinical setting or even an academic setting, really when we think about supporting the growth of our profession and even just, continuing to provide such value, I think at the heart of that, occupational therapists and our wellness is really the starting point, right? We want a profession that will be long lasting, which we know that it will be. And I think taking care of us as professionals really, in my opinion, should be one of the first things that we think about in order to keep doing the amazing work that we do. I think it's super important that we have these discussions, preferably from a preventative standpoint. Understandably, sometimes it's in retrospect, but nonetheless, I think it's super important just even for the long-term sustainability of our profession.
Yeah. And I would add too, I think there's this other spoke to the wheel that the more that OT professionals understand and know about it, the more it's okay to say, oh my gosh, I'm really struggling. And I think that, that's part of the work that we do on the Emotional PPE Project is breaking down the stigma, breaking down the barriers that healthcare workers do struggle and that it's okay to say that you're struggling. In the height of COVID and even now, towards the end of 2024, when someone says to me, that was really traumatic, what occurred. That was really hard to watch families see their families through the window. How did that impact you as a clinician? You kind of go, whew, holy cow. So I think through the preventative measures, the awareness and how we can change things, and then to just allow ourselves to talk about it without judgment, without stigma, and to know that you're not alone, for me, is really, really important as well.
Absolutely. That destigmatization can really be the first step into helping practitioners avoid compassion fatigue and burnout. You've all mentioned, some preventative measures or different things that we're hoping can help address this issue. What does the current evidence regarding burnout and compassion fatigue really show us about how it's currently impacting OT professionals?
Yeah, Matt, that's an excellent question. I'm steeped into this topic, and as I'm doing my doctoral research right now on compassion fatigue, but there's a lot of quantitative data that suggests that there are some really alarming prevalence rates of compassion fatigue in particular. Even as recently as today, I saw some literature that shows that upward of 92% of OT practitioners endorse some level of compassion fatigue, and even rates in the 50 to 60 percentile in other studies as well. And so we know that this is a problem in our profession and for other healthcare professionals as well. And I'm excited about some of the work that I'm doing to hopefully fill the gap behind the why, right? I think it's clear that we know the what, that we have some areas of concern with compassion fatigue and burnout as well. Yeah, really exploring the why I think is important as well. And I think even this podcast episode today can hopefully fill that gap.
Absolutely. So let's dive right into it. What is burnout?
I think burnout is for me is the easy term. Sometimes I have a visceral reaction to it, the same way I have for the word resilience, because I don't want to be resilient anymore. I think to DeOnna and Beth's work, they're helping us so that we don't have to be resilient. But when you're burned out, you're not achieving the stuff that you want to achieve. It's not necessarily of an interest. There's kind of a physical experience with the burnout. Your bucket is a bit empty, or your cup, to Beth's point.
I agree with you, Melissa. Sometimes the word burnout can kind of make us burn out within itself, because we hear it so much. An actual definition for burnout that I've seen is just being in a state of emotional, physical, and emotional exhaustion. So even you kind of being able to acknowledge all three of those elements, I think is true for burnout. We find that people often feel overwhelmed, emotionally drained, and maybe even unable to meet the demands of what they do as OT practitioners when they're burnt out. Compassion fatigue is kind of the emotional residue or strain of the exposure of working with individuals who have experienced traumatic events, and is often described as the cost of caring.
Right.
So a little bit different. The terms can be used interchangeably, but they're different. I think the context of burnout is often used in the work context, whereas compassion fatigue can really kind of be brought into caregiving professions, and I think can be really relevant to OT practitioners specifically.
For me, another difference with the compassion fatigue is it's not just about caring for the clients or patients, whatever the correct terminology in your setting is, but it's also working on and dealing with the systems that you're working in. It's also part of dealing with the family. And I say dealing in a positive manner, not that it's a negative thing, but those things wear on you, that stress from helping others. That's where, to me, the difference between burnout can come in.
So I think as far as research that's already been done, I think there's so much more out there on burnout than there is on compassion fatigue.
Yes.
There's not as much attention that's been brought to the compassion fatigue piece. And I think that, DeOnna, you brought up a great word when you defined burnout. When I think of burnout, I think of exhaustion. Mm-hmm. When I think of compassion fatigue, I think about that these practitioners are taking on this trauma that they're seeing from their clients, and they're providing all of this empathy and this care, and eventually they get to the point where that capacity to continue to provide that empathy just stops. They just can't keep doing it. They're drained. They're done. So oftentimes you see that, and I think it impacts in a lot of similar ways. So burnout causes that exhaustion, causes, a decrease in productivity, causes all of those same things that you sometimes see with compassion fatigue. But I think the big difference, at least in the research that I've done, the big difference is that with the compassion fatigue, you've got those specific traumas that you're dealing with, and you're almost carrying it as that like vicarious trauma that you've taken on almost as your own, or sometimes they refer to it as secondary traumatic stress, which is when you observe the anguish or the pain or the negative feelings of others who have experienced the trauma that you're hearing about. So as far as research specific to compassion fatigue, the research I'm most familiar with at this stage of the game is the research that I've completed myself on OTs and OTAs in academia. And what we have found is that a lot of them, up to 78% of them, expressed interest in learning more about compassion fatigue, and 52% of them don't have a plan in place for how to deal with that. And I think that that's a pretty big deal, given that, we as OT practitioners are really good at taking care of others, but not so much at taking care of ourselves. So that's where I'm, as far as my specialty or my knowledge in the research, that's where that comes in.
That was so powerful, Beth, and I'm so glad that you brought that perspective. I think what you said about what it means to be an OT practitioner specifically, I think we have a very unique and valuable and powerful set of skills and abilities as OT practitioners that really kind of sets us up to kind of feel that emotional strain. We're looking at our patients holistically, or even in an academic setting. We're able to look at, their physical areas of growth, but also their mental health challenges and their emotional health challenges. So when we kind of zoom out and think about compassion fatigue, I almost feel like OTs are particularly prone to this, and this could just be my own opinion and in my experience, but I think we're particularly prone just because of how deeply involved we are in the care that we provide innately, which is a beautiful thing. So it's kind of a catch-22, if you will.
I do think that you're right. I think that we are kind of predisposed to that as OT practitioners, partly because of the field that we're in and partly because of those personality traits that many of us share.
I think the secondary trauma piece that both Beth and DeOnna spoke to, Matt, to me, that's also what differentiates burnout from compassion fatigue, because that secondary trauma is, if you look at the research, and there's wonderful stuff these two ladies are doing, the very little I've done, stuff from the NIH, it talks about how that secondary trauma moves you, unfortunately, to the compassion fatigue. And when we think about the work we do as OTs and OTAs, and to me, this is like an overly fantastic opportunity to see how intra collaboration works right now between me, DeOnna, and Beth. But when we think about if we're working together, and DeOnna and Beth are doing the occupational profile, and you're really digging in on, that's what makes us unique, right? To DeOnna's point, you're really digging into what makes up a person, what makes up their occupations, what makes up their days, how that impacts their families, their loved ones, their roles, habits, routines. That's where I think we are so easily impacted by secondary trauma. We're hearing all of it and just taking that in from an auditory standpoint, but we're trying to address all of it as well for sometimes the most intimate moments of somebody's lives. I do think that's also why it's so easy for us to kind of fall into this pothole at times. And it goes back to the nature of occupational therapy that we all know from 100 years ago, starting out in the behavioral health, mental health world.
Absolutely. What would you say are some of the dimensions or signs of burnout that a practitioner may begin to recognize as they are working in their own field?
So with burnout, it's interesting because by definition, they kind of categorize it into three different dimensions. So the first one is what we've already been talking about. So that emotional exhaustion, so feeling drained, fatigued, maybe you're getting off work and it's like, I just don't have the capacity to do anything else. So that's the first dimension. The second one is depersonalization, which I think is a really fascinating one. And that's where practitioners may be prone to develop a cynical attitude actually towards work or those you serve, which is really maybe a little counterintuitive, of course, to what we do. But of course, when you're burnt out, or just struggling with fatigue, sometimes you can get a little cynical, or maybe you're so used to seeing, that stroke patient with the same deficits for many, many years. And it's unfortunately easy in the setting of burnout to become immune to that. And then the last dimension is reduced personal accomplishment. So maybe as an OT practitioner, you just start to feel ineffective and you're lacking achievement. Maybe your patients aren't having the outcome that they once did, or, maybe your idea of success, isn't manifested in what actually happened with them in terms of goals. And those are the dimensions of burnout by definition. And I'm sure you all can speak to that as well, but I can imagine chronic fatigue. Some research even says insomnia, forgetfulness, increased irritability, sometimes physical symptoms, headaches, stomach issues. It can really manifest in a variety of ways.
I agree. And I also have found in the research that sometimes it impacts their performance at work. So you might start seeing absenteeism or diminished work performance or tardiness or an overuse of sick days, that kind of thing. And there can also be physical manifestations. You could experience things like muscle tension and shortness of breath and sleeping issues, like was mentioned, headaches, digestive issues. So it can really affect really all aspects of the person.
Right. And I would add in there, I did a workshop on this multiple times and did it for AOT as well. But I had people fill out this kind of a self-care assessment. And it was a way to look at how burnt out am I? How stuck in neutral am I? That's kind of how I think about it sometimes. I'm just like, ugh, I wish you could see me. I just kind of, my body language, I just like slumped over. But it's that feeling of just being stuck and not interested in things. And there are some great resources and self-care assessments. And the first time that I did it with folks to see, like, where are you falling in this? You know, how often are you doing the things that you enjoy? It's really important for people to have that moment to step back and reflect. Am I being a little bit more irritable? Is the drive home from work just not helping? Do I feel like I'm kind of just phoning in my treatments? And I know we've all been there, and that's okay. You're allowed to have those days. Tomorrow's a fresh new day. But having that opportunity to look at some self-care assessments and stop and see, how much is this really impacting me? And then being able to talk about it.
Having that check-in is so important and can be so moving for practitioners to just check in with themselves, just like you just shared. And I wanted to add on to that as well, as we've kind of already opened the can of just destigmatization. But I think I would be remiss not to acknowledge that the far end of burnout and potentially even compassion fatigue can be some significant psychosocial things, such as depression and anxiety. And I just wanted to mention that because I think, again, these are things that, can be a challenge to talk about, but perhaps is the experience of many practitioners. Maybe you actually do have depression or anxiety stemming from the work that you do, whether it's the secondary trauma, thinking particularly of my colleagues who may work in like a critical care area, or maybe just an area of long-term care like Melissa has and Beth as well, where, it can even go as far as depression and anxiety. So I just kind of wanted to acknowledge that openly and even just share a space for those who that may be their experience and just say, hey, you're not alone at that. That can unfortunately be a tag on to burnout.
Right. And where the emotional PPE project comes in, the vision, and I'm actually going to give you the exact vision because it's really important. It's wicked short, but it's a world where healthcare workers utilize mental and emotional health support without any hesitation or worry. That's what we all do, I think, as OT practitioners constantly. But if you look at some of the data out there, less than 1 out of 3 healthcare workers actually goes for help. Less than 1 out of 3. And so that also kind of gives you an idea about how prevalent it is that OTPs are perhaps struggling and aren't getting the services. The emotional PPE project, it blossomed and bloomed during COVID in April of 2020 with, these 2 fantastic scientists, healthcare worker, preventative, cool people just looked at each other and said, whew, this is not going to be good. This is going to be a lasting impact. And that's where it came to be. And because they started those conversations and saying what DeOnna was just saying, like, you're not alone. As corny as that is, you're not alone. Less than 1 out of 3 gets the help. But over 2,400 healthcare workers across the nation got services. And those 2,400 people were serviced by 700 licensed practitioners who donated their time. And to me, that's just this fantastic opportunity for me to give back because, again, I utilize the service and I share that because it's important to normalize it, that you're allowed to receive mental health support, that life is hard many days. But all the things that you all are seeing as OTs and OTAs, it's okay if you're needing that help. As Beth and DeOnna have shared amazing data and numbers with you, it's really something that is highly prevalent in our world. It is something that we're all struggling with. And I think COVID was I hate to say this, but a blessing in disguise. Ugh, that feels terrible. But it has allowed us to have this conversation. I'm not sure that the four of us would be having this conversation pre-2020. I don't know if Beth and DeOnna, feel free to disagree with me, but I think it was too taboo and not anything that we were comfortable saying out loud.
Totally agree with you, Melissa. And I think that it was a really challenging time for many of us, personally and professionally. And I think because of that time period, and I included myself in that statement, we have been able to open the door to have these really valuable conversations. And I'm hoping and I'm optimistic and I'm excited to be a part of conversations and work that can allow us hopefully to not have to go through something like that again without the support. So totally agree with that, Melissa.
Part of being an OT, I think just developing that willingness to acknowledge and kind of take a step back from your role as a practitioner to really see, oh, am I burnt out right now? Am I experiencing compassion fatigue? You know what? Now that I think about it, I have kind of been on autopilot recently. It can be difficult to do, especially if someone's in the thick of it. And it's tough to recognize kind of those, coping strategies or autonomic processes that we all develop to just keep going and to just keep working and just keep doing what we need to do to survive. How is kind of the environment and social stressors influencing burnout amongst OT professionals as well?
Ooh, that's a loaded question.
It is.
Yes, I agree.
I automatically thought social media, right? Like there's the great side of it, but that's an environmental influence. And then because of my world in skilled nursing, I went to productivity and reimbursement. And then,
yes.
Then I went down the whole policy, I'm over here thinking of 100 things, but that's where, when I say everyday clinician, the clinicians who are treating in the largest areas that we see are clinicians, be it school or skilled nursing, physical rehab, that's what folks are dealing with every day. Caseload, workload, productivity, wicked high expectations, what feels like an ever demanding world that never lets up. That you are just go, 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 and never get a chance to process anything or never get a chance to talk about things or never get a chance to try that really cool new treatment intervention. So for me, that's one of the biggest environmental changes or impacts, I should say.
Absolutely. I'm kind of approaching this with a PEOP perspective. That's kind of how I'm breaking it down as my clinician is coming out. But what are some person factors? Like how does someone's, personality or their own predisposition to, stress and stressful situations impact the development of compassion fatigue and burnout as well?
I think that one of the things that I have found in my research is people that are more prone to being empathetic and feeling what other people feel are often more prone. I think also people that don't do a very good job of taking care of themselves at a baseline where that self-care isn't great. They give and never, okay, let me take care of me. I think those are the people that I have found are the most vulnerable.
I agree with that, Beth. And I'll add to that, I think just the idea of having to be perfect, right? The perfect practitioner, the perfect treatment, the perfect evaluation, having a high quality of work, which is awesome. And even beyond that, a high standard, which again is awesome within itself, but can often maybe predispose to burnout because how long can we go with, being that perfect clinician and meeting your productivity expectations, like Melissa said, and doing all the things, getting your CEUs, supporting your colleagues, going to the lunch and learn. It's just not realistic, right? So I think many of us have a high standard for ourselves, which again, I want to acknowledge is wonderful, but without kind of having that balance, which I hope we can talk about even later in this conversation, it can certainly lead there. And I think, too, just a strong sense of responsibility. I think most, if not all of us, just want to do good. We want to help our patients. We want to help our students, whatever context that we work in. And again, I acknowledge these things as wonderful and beautiful things. But I think that strong sense of responsibility can often lead us to inadvertently neglect ourselves and kind of go into lack of self-care, like Beth said. So yeah, I think those are some other personality traits that could be influential.
I grew up always being told by whomever, you're too sensitive. Don't be so sensitive. Don't take things to heart. Don't care so much. And I first of all, it's okay if you're sensitive. Let's just clear that right up. But if you're that person, and you probably have those traits if you've become an OT or an OTA, because, like my friends here said, this is a giving profession. I think we all came here with altruistic ideas, and we love therapeutic use of self, and we wanted to make the world better. And so those characteristics that were once labeled as negative really aren't. And I purposely say and not but. And those characteristics are also the ones that make our work great and also can make our work difficult at times. And it's important to recognize that it's okay to be the empath, to be the sensitive one. It's okay to be the driven one. And how do you take care of yourself, and how do you take care of your peers, your OTA partners, those type of things?
Absolutely. It's such a profound topic. And, that brings to mind what Beth said previously about making sure that your own bucket is full enough to help fill someone else's bucket as well. I wanted to ask about a measure of job-related stress, the Maslow Burnout Inventory. I think I'm saying that correctly. Correct me if I'm not. But it's the most widely used measure of job-related stress in human service professions. What makes this instrument the gold standard, according to AOTA?
That was a good one, Matt, because I was like, is that the gold standard? Did I miss? And I went down kind of DeOnna's path of like being the perfect clinician. Like, did I miss that was the gold standard? So I had to spend some time re-looking that up and re-reviewing it. I think it's utilized so often because it's an easy tool. It's quick, it's down and dirty. You can get right to the point of like, am I struggling with this? It's used in other healthcare worlds besides just occupational therapy. But I do think it's one of many out there. But I'm hoping with Beth and DeOnna's research that we have more tools, and more tools that are more applicable to us and less general, that we can utilize.
I agree with you, Melissa. I would love a world in which there was a burnout assessment for OT specifically. So if there's anyone listening who has an interest or a passion for creating tools, this is my bid to you. But no, I mean, this particular inventory has been a long-standing one. To Melissa's point, it's been used interdisciplinary, and it's pretty comprehensive. It looks at all three of the dimensions that we mentioned earlier. So it's a sound tool, and I think that it's a good starting place, right? Because we know that before we address a problem, we need to evaluate it, assess it, just kind of like we do as OTs. And so I think at the very least, this is an excellent validated tool that could be used as a starting place. And yeah, I agree that there's other tools out there that could totally be valuable as well. But it's a good one. I've used it a couple of times myself.
How would more tools for quantifying burnout and compassion fatigue, how could that help the profession to really avoid it? And what's the next step? What are we hoping we can begin to do to help practitioners be aware of their own level of compassion fatigue and burnout by using assessments?
Oh my gosh. I think we could be using it in OT and OTA school, kind of, what Beth is doing. I think about doing it at different intervals during field work, or during baccalaureate project and capstone projects. New hires, I think about, your first 90 days as a new hire. Okay, so you taught me bloodborne pathogens, and you taught me, where to use the restroom and maybe my documentation, but how am I really doing? How am I really doing working on that unit? How am I really doing, processing, working in a system where maybe I think a client needs more care, but they're being discharged? I think there's opportunities there. And then I also think, the opportunity to be able to use it and come up with a plan for that compassion satisfaction. That's where I love the ProQual, the professional quality of life scale. My first introduction to that was actually from somebody in the psych rehab world, but it's so applicable for us. And I don't know, DeOnna and Beth, I know this is also we all get so excited, Matt. We're like, You share.
Yeah, and I can jump in a little bit. And I love that you started there, Melissa, because the thought that I had was really kind of connected to the work that I do with public health and kind of connecting that to occupational therapy. I think to answer your question, Matt, really using this data could be so powerful on a systems level when we think about health policy design, when we think about wellness program design. We need data. The people who have influence where it matters, whether it be in our healthcare systems or even in governance, even with our own association or what have you, I think having data, right, from validated tools is going to really be necessary to adequately and efficiently inform policies and things kind of on a higher level. So, yeah, I think having tools like this, whether we're using the ones that we have or creating ones, will be super important when we think about change on a systems level.
I agree with that. And I think to add to that and to what Melissa's already said, I think that having a variety of tools that we could utilize in assessment is going to be beneficial for OT practitioners, just like it's beneficial for us when we're working with our clients, because different circumstances, different people respond better with different assessment tools. So I think having more than one opportunity, more than one option is a great thing. I think having something that someone else could do on the practitioner may be helpful. I think for some of those practitioners that don't really want to reach out to other people, something like the ProQOL that Melissa mentioned, that's a self-administered tool that can be done and can raise awareness right there in the comfort of your own home, if that's where you want to do it. Looking at kind of what's required to do the assessment and then what that practitioner's willing to do really will say which tool would be best for that person.
Just like occupational therapy, right? Like the three of us might approach a treatment session or, building goals together differently. But it's all about what's best for that person. And I think that's why we have to talk about this more. That's why we have to break down the stereotypes and the stigma that come with healthcare workers who need support. And this is why we also have opportunity to advance the mission of occupational therapy. The work DeOnna's talking about with public health, the more that we can show that there's more of a need and there's a solution, like that's a perfect little package for occupational therapy. We need to be there. We need to have our services reimbursed. And we have to start talking about it more.
Yeah, absolutely. I hope that having this conversation helps practitioners, myself included, to recognize the importance of addressing burnout and compassion fatigue in our lives, and hopefully to add some of these measures or some of these approaches to our own OT toolbox and our own intervention toolbox, and develop it a habit, whether it be reflecting on our own lives and how it's affecting us, or from a more systems level. As you've mentioned, our presenting sponsor is New York University Steinhardt's top-ranked Department of Occupational Therapy, which now offers an entry-level OTD for aspiring occupational therapists. NYU additionally offers advanced degrees for practicing therapists that can be completed in person or online. Study and work with leading educators, researchers, and master clinicians in the vibrant setting of New York City, and have access to a diverse patient population and extensive healthcare system. Learn to deliver exceptional patient care, or deepen your knowledge and practice as you focus on applied scientific inquiry and clinical areas such as pediatrics, developmental disabilities, mental health, and assistive rehabilitation technologies. Take the next step by visiting steinhardt.nyu.edu/OT to learn more. I really want to ask each of you about your own experiences with burnout and compassion fatigue, and ask for recommendations for myself, for our listeners, for our profession as a whole. What are some experiences that you've had with burnout or compassion fatigue in your career, and how did you really keep going?
Yeah, I can start. It's so interesting because I think the topic around compassion fatigue, burnout, and even just mental health overall has always been a passion of mine. So I remember early in my career and even just throughout, I would often be found doing webinars or lunch and learns on this topic, really to support my colleagues and myself and all of that. And then when COVID hit and I was working on the ICUs during that time and really just trying to navigate the really sharp change in my day to day and trying to treat patients with a virus that we didn't know anything about at that time, was just really challenging. And I found myself experiencing the very things that I, talked about, kind of from a theoretical standpoint. I think about, for example, the very first COVID patient that I ever treated. I was with one of my very dear physical therapy colleagues, and we're getting all gowned up and getting all the PPE on. And my colleague is such a cool and collected guy. And he's like, "Hey, DeOnna, the patient's on the floor." And I'm like, "What?" He said it so calmly, I almost thought he was joking. And then I look in the room, and the very first COVID patient that I ever treated was on the floor to start. And so, oh my goodness, like this is already a stressful situation. And now we're in another type of stressful situation trying to serve this patient. Think of other scenarios where one time I opened a patient chart and it was a patient with the same exact birth date as me, which was just so viscerally alarming and humbling and scary all at the same time. And I remember times just being asked quite literally with patients on life support, am I going to live? Am I going to make it through this? And not really knowing what to say in those moments. So when we talk about compassion fatigue and burnout, it's close to home. It's been my actual and literal experience. And that is why I've been so passionate about just sharing my experiences and my stories to really just help others to know that it's okay to talk about it. And I think in terms of how I've allowed it to be something that I've turned for the positive, is just being a part of conversations like this and really just having a passion for discovering what it takes for us to be well, right? Whether it's a pandemic, whether it's, a stressful day at work, or whatever the scenario as an OT practitioner, what does it take for us to be well? And I'm passionate about talking about that, researching that, connecting that with public health, and just looking at OTs as a community. But that all, frankly, it stems from my personal experiences. So I'm humbled to have the opportunity to talk about, to really open the door for those who may have had similar experiences.
DeOnna, unlike you, I did not know about compassion fatigue when I was practicing in skilled nursing, and I felt a lot of these things that we're talking about, and I think I experienced a lot of what we're talking about, but didn't know what it was, didn't know how to identify it, didn't know how to help myself. So it was definitely something that I struggled with, had to kind of learn the hard way, so to speak. I don't want anybody else to have to go through what I went through, and trying to figure out how to deal with those feelings and thoughts and emotions without having an idea of who to turn to or what to do. So I think that's been probably the biggest drive for me doing this research. And then also looking at, oftentimes OTs and OTAs that are in academia, that people don't think about them also dealing with things like burnout and compassion fatigue, because we're not daily dealing with clients, right? Like a clinically practicing practitioner. So like DeOnna in acute care, but we deal with the trauma and distress of our students on a daily basis, and often wear a lot of different hats. And so I think also my passion also comes in providing some awareness in that area and helping others to see that there's a need there also.
I caught myself over here, Matt, just getting a little tearful, and that's who I am, and I embrace it. So I ask for your grace. But I think for me, when I first started to understand I was experiencing compassion fatigue was during COVID. I've probably experienced it my entire career and never talked about it. And like, many people, whether you were there front lines or not, you experience things. And my first night working as a CNA, I had to have a nurse yank me by the arm, behind the desk and say, "Come over here, Melissa." And I'm thankful for her. To this day, I won't say her name, but she said to me, you're going to do stuff tonight that doesn't feel right, that doesn't go with everything you learned in school, that is not book and picture perfect. And you're going to do it. And you're going to do the best darn job that you can do. And you're going to be okay with that. And like everyone, without supplies, without the things we needed. And I was like, okay, if you're here, we can do this together. And that night, my goal was to make sure people were fed. That was it. All the other things I moved out of my head. But what I started to realize for myself and then my team was we were constantly waiting for that next yucky, horrible moment. And we started to spend time on Zoom in silence, just complete silence. And I was like, this is not right. What are we doing here? And that's when I first started to do the reading and started to figure out these bizarre feelings that I had experienced, but not in the grandness, if that's a word, that I was experiencing at that time. And that's when I started to look it up and start to figure out and realize there's a name for this. There's this compassion fatigue going on. And it's not that you don't have the skills, Melissa. It's not that you don't have the emotional intelligence or you're not a strong enough clinician or good enough leader to deal with this. This is serious stuff. And I learned that through, my services through the Emotional PPE Project. But that's when I realized it was a real thing. And that's when I started to find ways, Matt, to help combat it, to help talk about it, and just giving it a name that was a true name, that was out there with research, not as much as I'd like to see. And that's why my friends DeOnna and Beth are going to help this. But to actually say to people, this is what you're going through. You didn't make this up. It's not in your head. This is legit. And this is what it means. And that's how I fell in love with the topic. As weird as that is to say, that's when I fell in love, that there's really something there. And most, probably all of us, have experienced it somewhere and somehow.
Thank you so much for sharing these experiences and giving us insight and how these topics have impacted your own life. That first step to really acknowledge that compassion fatigue and burnout are a thing and that they may be impacting your own behavior and your own well-being is such an important step. That's become a theme, I think, already in our conversation, is just acknowledging that this exists and it may be in fact impacting you can be the first step to addressing it. What are some other recommendations or changes that practitioners could make to combat burnout and compassion fatigue?
I'm not a good person about taking care of myself, right? Like, I know I need to exercise more. I don't need those chips and queso. But what I need is an accountability partner in my self-care plan. I don't want a self-care plan that says, do 4 deep breaths this morning. I need that stuff. I know that. That kind of plan isn't going to help me. And so I actually found an OT accountability partner through talking about compassion fatigue in Kansas. So I live in Boston. And I met this fantastic OT. Her name is Terry. And I was presenting on this topic, doing a pretty big workshop. And I said, listen, I need someone who will check in with me once a week. And she said, oh my gosh, I need the same thing. So every single Monday now for, 3 years, almost 4 years, we provide some type of check-in on Mondays. It can be a meaningful quote. I love quotes and things like that. That was my first step into getting myself a plan together to take care of myself. And it was just that simple thing. And I know that she depends on me. And for me, that's my helping need. I need to know I'm helping someone to feel good about myself. Maybe you might say, well, that's a little externally motivated. Might be, but that's who I am. And I've embraced that. And so I know by checking in with Terry that I'm helping her and that's helping me, and the same for her. She had that connection and a loss from somebody else that would do that for her. So that consistency helps her. So that's my little plan is finding that one small step that doesn't take a lot of time. It doesn't take money. It doesn't impact, I don't have kids, but she does. It doesn't impact, getting her kids to and from soccer, to school, things like that. It's a small gesture, and man, it makes the world of difference. I'm always looking forward to a Monday. And if it comes in the afternoon or I don't text her to the afternoon, we're both like, oh, phew, okay, I'm glad I heard from you. And that's one of my little small strategies, is an accountability partner.
I love that. That is such a wonderful strategy, and bringing community into it can really make a huge difference. Beth, how about you? What changes or recommendations would you give?
One of the things that I've heard a lot of is practitioners will say, oh gosh, you're going to try to make me do another self-care plan. Like, how am I going to fit one more thing into my life, right? And I think that even the thought of adding in that 15-minute exercise or that mindfulness or that whatever that thing might be for you can be super overwhelming. So one of the things that we have discovered is trying to incorporate some of those things into things you do every day. So instead of completing a separate mindfulness activity, participate in mindful eating, participate in a mindful walk when you take that walk every day at your lunch, or participate in mindful ADL participation. So when I'm brushing my teeth, I'm thinking about how does the toothbrush feel? And so just stepping through, what can I add something beneficial to that I'm already doing every day anyway? The other thing that my colleague that I'm doing the research with did as she started her self-care journey was for 1 minute every day, she did what it was that she felt like she needed to do to bring her positive self-care. And she would dedicate that 1 minute and she'd be watching the clock. Oh my gosh, if this minute doesn't hurry up and end, right? And then eventually though, she started craving that minute, and then she wanted another minute, and then she wanted more minutes, and now she runs marathons. So it's a huge commitment to even do a minute a day when you feel like you're that stretched, right? But making that small little change sometimes can lead to very big changes in the future, and you don't even realize it. That's one of the things that we have found to be helpful.
DeOnna, what about from you?
Yeah, just to add to that, I would just encourage just being courageous enough to prioritize joy in our life. And I know that can sound a little fluffy, but what I mean by that is really honoring those moments of joy or even leisure. We talk about that, in terms of our scope of practice. Or whatever that looks like, really honoring that as just as important as a work appointment, or maybe that outpatient, patient appointment that you have, and honoring that time in your life and prioritizing that time, I think is one practical way that we can combat burnout and compassion fatigue, and even prevent it. I think oftentimes, and I am certainly guilty of this, we prioritize the things in our life that are super important, like work and, taking care of others and what have you. But we often kind of put those things that actually bring us joy on the back burner. So there's this technique called calendar painting that I actually just learned about this year. And it's a way for those of you who are intrigued by organization and calendars like me, it's a way to honor time on your calendar just as much as you honor time for something else. So that's probably a whole podcast within itself. Just a practical way that you can say, hey, I'm going to go hang out with my friends this weekend and go to the movies, whereas maybe I have plans to study. And it's not so much about not being responsible to those responsibilities, but rather honoring those moments as just as important as the other things that we do. And then I would also just be remiss not to acknowledge reaching out for resources, right? We talked about the resources that we have even at the Emotional PPE Project, or maybe it's resources at your job, EAP. I actually have the privilege of working for an awesome wellness program that provides different services to our employees and clinicians. So really taking advantage of resources. There's so many things that are cost effective, even free, that could really be powerful to manage the things that we're going through. So yeah, I think those would be my small recommendations.
I live by my calendar. It's color coded. It's my life. Okay. But there is research out there that speaks to what you just spoke about, a calendar painting. And it's about actually scheduling those non-work things in your work calendar, meaningful things. So when we think about meaningful, that's a word we all connect with as occupational therapy practitioners. But the simple thing of, like you said, going for a walk or a coffee chat or just, I don't know, read the funnies in the Sunday paper if that's what you like. But those are meaningful things and not to qualify them as the less than important things. They're just as important as groceries. They're just as important as taking a shower. They're just as important as paying your bills, but actually putting them in the calendar and making them as busy, not just free. And then that next goal is to then do it, to take that time. Because to me, those are two totally separate tasks for me. I can put it in there, but now I've got to do it as well. So I'm so glad that more people are seeing that research about blocking off your calendar for meaningful non-work things.
Yeah, I love that. Those are wonderful recommendations. Are there any additional, evidence-based or recommended interventions for addressing burnout and compassion fatigue that you'd like to turn our listeners' attention to right now?
There's some great articles, and feel free to reach out to me at my AOTA email, mtilton@aota.org, and I'll share some of these. There's some great bioethics ones. There's some NIH ones. But one thing that I wanted to share about is Schwartz rounds. I don't know if anyone's ever heard of those. They've been around for quite some time. And it seems like when I'm going to tell it to you, you're going to be like, of course we can do that, Melissa. But it's the simplest moment of having time with people where you just speak to one another about what's going on. For me, this is my interpretation. I liken it to being able to share at perhaps an AA or an NA or an Al-Anon meeting, where you share without judgment. You share without anyone trying to solve what you're feeling. And the Schwartz rounds can be done in a very formal manner, in a very large scale, or simply in your OTA collaborative session, where you can just talk about, this is what happened today. I did not do a great therapy session. I used those, pink 1 pound weights. I don't even think the person enjoyed it. I certainly didn't enjoy it. And it was really hard because of this, or this. But the Schwartz rounds, you can Google it and read more about it, and also reach out for more literature. But it's just that opportunity to debrief, if you will, to share. I experienced my first one during COVID, and that was heavy. It was very heavy, and I wasn't prepared for that. I wish somebody had warned me. So I do encourage you to read about it and actually have a conversation. If the four of us were going to do it, let's talk about the ground rules. Let's talk about the timing. Let's talk about the topic, and the confidence of what is shared is between those people in the room. But there's phenomenal research and literature out there about the benefits of the Schwartz rounds.
I've heard about the Schwartz rounds as well, and haven't had the opportunity to engage, but I know that is something that is very valuable and is actually widely used in a lot of institutions. So yes. I'm so glad that you shared that. And I would love to add one more into the hat, which is therapeutic coaching, or maybe even lifestyle coaching. I actually have had the honor to do some lifestyle coaching in my current role. And it is so powerful to be able to kind of process everything that we're just saying and making it a plan that works for your specific life, right? So maybe you're hearing all these wonderful ideas, Schwartz rounds, or mindful walks, or what have you, but you're just like, okay, that sounds great. I have no idea how to make that real for my life. I'm a full-time clinician. Maybe you have a PRN job on the side. Maybe you're a parent or whatever, and you just don't know how to make that real for your actual life and your actual schedule. So I think working with a coach, whether it's a lifestyle coach, health coach, there's some research about therapeutic coaching. Sometimes these things can be used interchangeably, but nonetheless, being able to work with someone who can kind of look at your life, help you to look at your life, set SMART goals around some of the health goals that you may have, whether it's around stress or incorporating leisure and joy into your life, and just having that support to make it real, I think is an excellent resource that OTs can look into.
Thank you so much for sharing those resources. How can a practitioner use a preventative lens to hopefully prevent the development of burnout and compassion fatigue? Are there specific recommendations you would give?
The term that we use is compassion satisfaction. Some of the very same things that you do to cope with compassion fatigue are the same things you need to do to develop that. I think one of the things that I would add in addition to that self-care planning and the mindfulness and all of those great tools that we mentioned is really just setting boundaries and saying like, okay, I'm going to take time for me so that it doesn't turn into this, I think is another big part of how you do that preventative care.
I think a preventative strategy is to just have these conversations from day one. It's in your clinic, it's in your classroom, it's with your new hires. It's not just the thing we say that we do that we don't really do. And that we say to folks, you're allowed to just acknowledge that you're having those moments and those thoughts and that you're thinking, and you just sit with it for a minute. It's easier said than done. This is what I work on every week with my person, but just taking that minute to acknowledge that it's hard and that it's okay that it's hard and it's okay that there's hard days. And, making that conversation part of, in particular, I think OT and OTA collaborative sessions, supervision meetings, where you have those conversations and, we help each other from maybe not going down too far down the hole. And we just say, okay, just acknowledge it. I would want Beth to say, okay, Melissa, thinking. And I go, okay, you're right. Hard day. This was really hard. I'm really sad. Boy, I feel fried, whatever it might be. I feel stuck in neutral. And then that person is acknowledging it and make it part of those everyday conversations, not such a taboo, yucky thing to talk about. We got to talk about it.
I would love to make a call out to our leaders, within our profession, whether that looks like, you're a leader in your clinic or maybe in your community setting or what have you. But I think from a prevention standpoint, we have such a unique opportunity as leaders to be able to inform the workplace culture that we facilitate for occupational therapy practitioners. And it's just a great opportunity to have these conversations and even advocate, or even be an activist for ensuring that the therapists that you lead in whatever setting are well taken care of in that way. And I actually love one resource that I'd like to share. It's called the Impact Wellbeing Initiative from the CDC. And it's actually designed to address the high levels of burnout among healthcare providers. And it provides just wonderful tools and resources, really kind of from the perspective of leadership or even hospital systems. Again, kind of going to that systems level thinking. Whereas, yes, it's so important and relevant for us to talk about what prevention looks like from the therapist level. What can we do? But then also, what can our hospital systems do? Or what can our clinic systems do? What can our national or state organizations do to support this? And so the Impact Wellbeing Initiative is a wonderful resource that kind of informs this. It provides, again, resources, evidence-informed actions, a supportive environment, and so many different things that can be helpful for the leaders out there who are looking for ways to prevent this on their team. So I hope folks will check that out and kind of see how that can be relevant for their working environment.
We love a good resource. Thank you for sharing those resources and those recommendations. I love that piece about how we can, expand the scope into that systems level as well. What are some recommendations you'd give for a practitioner, maybe of things they could look for in a system or in an employment setting that would reduce the risk of developing burnout and compassion fatigue?
And I'll speak from personal experience kind of on both sides of things. So I work for an amazing academic teaching institution here in Nashville. And when I worked at this institution as an OT, I tapped into the resources that they had here at the hospital. And so many of you may be surprised about the resources that are actually readily available that we just don't know about, such as lifestyle coaching, like I mentioned earlier, or maybe it's stress management resources, maybe it's just health resources overall. And I'm speaking differently from like HR benefits, but more so programming that is set up to support you. And so, again, I think I would just, do a quick Google search of, your institution and wellness programs. And I would not be surprised if many of the resources that may be available that you just don't know about yet. I think that would be one way to start with that.
that question is such a loaded question because I think sometimes people go, "Ooh, I'm not sure if it's safe enough for me to ask," right? Like there's this automatic assumption that we have that we don't want to ask because we don't know what someone will think. We don't know if it's safe in the sense, will they judge me? Will they not hire me if I'm asking this on an interview? This is the work that DeOnna and I do with fabulous board members at the Emotional PPE, is that it's okay to ask. And I think DeOnna gave great examples of how to ask. And you could even ask things about, do you have anything like Headspace app? I think Headspace and Calm, for me, became really well known during COVID. And now many places have it as a benefit. Maybe you start with a softer question that feels safer for you. Like, do you have any benefits around like gym membership, health membership, mind body work that we can do? And you've kind of opened the door. The gym feels a little less scary from a mental health perspective, because you might be afraid to ask, like, what's your EAP program like? And unfortunately, some people who are receiving that question might not answer it well, or they might judge it. So I think you could ask things about that. Like, it's really important to me as an occupational therapy practitioner to have balance. What are the things you offer here as a benefit or as a resource for me to have balance? Or, can you tell me what are the things that you do to honor and celebrate your clinicians throughout the year? Maybe ask them what they do for OT month. I think those are some safe ways to start to crack the door open a little bit. If you're not comfortable specifically saying, what do you have for resources for X, Y, and Z?
A beautiful answer. And on everything you've shared today has been beautiful. It's been educational. It's been encouraging. I really appreciate the time that each of you has taken to be on the show. I think we can move to wrap things up. What additional resources or actions related to burnout and compassion fatigue would you recommend to our listeners?
This is Melissa. I would say check out the Emotional PPE Project, which is emotional PPE, just like your PPE.org. And there's some fabulous resources there, and also some places that can take you to those next steps.
I would certainly encourage, if you don't already have a network of support, to really start to think about what that could look like for you specifically. Maybe it's a group of, your favorite coworkers at work, or maybe it's a community group, or, amongst your friend circle. I think it's so important to start the conversation about how you're doing, what it's like to be an OT practitioner, the things that you experience day by day. And hopefully you have those safe spaces to share that. And if not, again, Melissa just shared a great resource to get that started. And I think that having that support, being courageous to share your voice in those safe spaces is something that I certainly recommend as a great starting point.
A big thing for me that changed things when I found the ProQOL website was super helpful as a check-in for me personally. So I think adding that as a resource would be great, which is the ProQOL.org.
We end each episode with the Golden Nugget segment. And I ask you all one final question for the road. If you could share one thing, a piece of advice, a recommendation, whatever you would like to say with practitioners, what would you say?
I would say what you're feeling is valid, and your feelings are valid, and your feelings and experiences matter.
To be sure to take time for you, set boundaries and take time for you so that you can be the best practitioner you can be.
That there are resources out there to support you. You're not alone. There are people who share your experiences, even the experiences we've shared today on the episode. I hope is a great starting point for conversations that can be so meaningful and powerful for you. So just know that, one, you're not alone, and two, that there are resources out there that can help to support you and help you to continue to be the great OT practitioner that you are.
I love that. That is such a powerful message to end on. You are valid, you do matter, and you are not alone. DeOnna, Melissa, Beth, thank you again so much for being on the show today and sharing your time and knowledge with us.
Oh, thank you
for having us.
Yeah, absolutely. It's been such a pleasure to be here. I think this conversation is just one that we needed to have. And so super honored to be a part of it. Thank you all.
I agree. Thank you, everybody. This has been refreshing and exciting to think about bringing attention to this important topic.
All right, today we are joined by Yael Gover-Rover and Janelle John from the Department of Occupational Therapy at New York University's Steinhardt School of Culture, Education, and Human Development in New York City. Thank you both for sharing your knowledge and expertise with us today.
Thank you. Thank you for having us.
Yes, it's my pleasure. I've been looking forward to speaking with you and learning a bit about NYU Steinhardt.
So I'm Janelle John, and I am the Associate Director of Enrollment in our OT department.
I'm Yael Gover-Rover. I'm a professor and the director of the post-professional program at the Occupational Therapy Department.
It's an honor to speak with you both. Introduce us to the NYU Steinhardt Occupational Therapy Department itself.
So the OT program at NYU is one of the oldest, largest, and most highly rated occupational therapy departments in the U.S. We're located in the heart of New York City in Manhattan's Greenwich Village, and our department offers curricula that balance academic, scholarly, and practical experience through clinical placements and collaborative research.
That's wonderful. There's a rich history in New York City as a whole, and especially at NYU. I'm happy to hear and learn about how that's represented within the occupational therapy department. What are the degrees offered?
In our department, we offer the entry-level OTD, and that degree is for graduate students who want to become occupational therapists. And we also offer post-professional degrees. We offer the post-professional Masters of Arts, the OTD, and the PhD. And those degrees are for credentialed OTs who want to further their education in occupational therapy.
I love that. There's a variety of entry-level and post-professional degrees. How would you describe the student experience within each of the degrees offered?
They have a very rich experience within each of the programs, and each program is also very different than the other. They're also having a lot of opportunities for fieldwork and capstone within the New York metropolitan area, which are very rich experiences. Particularly, I love the PhD and the OTD in occupational therapy at our university. The PhD is really PhD in occupational therapy, and there's not many programs in the United States that actually offer PhD in occupational therapy. It's a lot about rehabilitation science and public health, etc. So here we are offering specifically in occupational therapy. The master's is a great opportunity to be in New York. Many people, it's the post-professional masters. These are usually designed for people who had a bachelorette from another university. Mainly we have international students in this program who comes from Asia, Europe, the Middle East. And these students actually take electives with the entry-level program. The experiences are really rich in terms of the exposure to faculty and to things in the city within fieldwork and capstones.
How much of each degree would you say is spent in the classroom or a virtual setting or a clinical setting? And do students in the post-professional programs, are they typically working while attending, or how's that all organized?
Sure. So our entry-level OTD program is an in-person program. It's also a full-time program. Our post-professional master's is an in-person program, and it's full-time for international students and part-time for domestic students. Our PhD program is also in person, and that could be a full-time program or a part-time program. Our full-time PhD program is fully funded. And then lastly, our post-professional OTD program, that program can be done full-time or part-time. And that program is the only program that's 100% online and can be completed online, 100% online.
Wonderful. On AOTA Podcast, we absolutely love research and we love theory, especially occupational therapy theory. I want to ask what occupational theories and approaches to care are emphasized within your curriculum at NYU Steinhardt.
This is a very good question because it made me go into our curriculum and think a little bit about it. So, of course, we have the main theories that guide occupational therapy, such as the person-environment occupation. We believe that it is a core model for learning and also for practicing later. For me, as a researcher and a clinician, these elements really, I see them as influencing functions, like the elements of the environment, the occupation, and person. So with this lens, we really teach how occupations are affected by all of these variables. We also, of course, look at the MOHO, the model of human occupations, which is rightly taught. In addition to all the core models and theories that guide our profession, here in the department, we have core faculty who deal with models and way of thinking that really influence our curriculum. For example, we have the client-centered practice together with the strength-based approach. So in this approach, we don't necessarily look at the impairment and what is wrong and try to remediate, but we really try to think, okay, what does the person have that we could capitalize on and the person can actually function better with the strengths they have. This started actually with Professor Patton in autism, and she gave the Elinor Slager lectureship a few years ago. I really emphasize in my classes a lot of cognitive theories, especially the strengths-based approach. I also emphasize it in my classes in the functional training and metacognitive training. So these are some examples of how we integrate not only the general theories that every OT department should and need to teach. We also really look into things that we are expert of and try to elaborate on these.
How is interprofessional education integrated into learning at NYU?
So in the fieldwork, I think it's one of the first exposures into how to work in interprofessional settings, and then you are being educated from other professionals who work in rehabilitation or education settings. We also have another part that we actually started it. It was very interesting. We started it during the COVID time because during COVID we couldn't really offer a lot of fieldwork in person like the rest of the world. And we started simulations, and these simulations actually were very interesting because we used actors from other departments in the university, like theater, for example, and we asked them to come and present a case. And then the students really had to work on what will the occupational therapist do, what other professional, how we would contribute to this. Sometimes we could collaborate with other professions such as PT or speech language therapist. We have the collaborative coursework more in the post-professional degrees where our students can study with other students from other departments. And then I love it because they can get and hear perspective from other professions, again, such as PT, nutrition, public health, social work. A lot of our students go to social work to take some courses. So there's many opportunities. I think the sky is the limit to how a person would like to collaborate during coursework and case studies with other departments and other professionals.
Yeah, that sounds amazing. Yael, Janelle, what makes NYU unique when compared to other occupational therapy programs?
Being an academic department within Steinhardt and New York University, our students have access to all of the amazing and wonderful resources that Steinhardt and the university offers. And there are tons of resources, and we always tell students to take advantage of every and anything. The resources include, but definitely are not limited to, like student life and engagement, like wanting the students to be a part. This is a large university, but it's important for them to feel like this is their home, to be a part of it. So there's a lot of opportunities for that. Opportunities for career development. Wasserman, while they're students and when they're alumni, there's still opportunities for that. We have an amazing library. Our academic workshop for students who are in programs and just need some extra help, there's support for that. Also, because NYU is so large, students can take courses from other departments within Steinhardt and the university. NYU is also a global university, so students can take courses globally, and there's a lot of opportunity for that.
I think also what is very, very unique at NYU is the fact that we are an urban university. And I can see it, some people maybe will see it as a weakness. I see it for now as a strength, which we are part of the urban environment. So NYU is not a campus. We are actually integrated within the Rest Village. I think that the fact that we are located in New York focuses us on issues such as the context and the culture, the socioeconomic, environmental factors that affect occupational performance. We have Dr. Chippendale in our department. This is actually a nice study that she's doing, and she's actually assessing the streets of New York for elderly individuals who actually need to move with walkers or with canes. And she really assessed what contributes to falls, what facilitate better transitioning. So all of this is taken, like, this is the beauty, I think, of studying within the streets, within the city. You just go downstairs and you can do your study, or you can bring a point to discussion. Janelle also touched on the global experiences, which is another point. And many of the faculty took students abroad to study about disability in global context. A few years ago, I personally took students to Israel. I thought it could be a very interesting experience to study firsthand how disability and rehabilitation happens there. We took students last year to Korea, South Korea, to China, to Argentina. These are open courses not only for occupational therapists, but also for other students from the university who are interested in that. And I think that also at NYU, we are focused on research. I'm a professor here, and research for me is a core component of our profession. Without research, we cannot move the field forward. We must provide evidence to support our practice, to support our evaluation tools. This is a very important point, and we really emphasize evidence-based practice. For the post-professional programs, I think the faculty mentorship is really excellent, and in both the post-professional OTD, the masters, the post-professional masters, and the PhD, mentorship is emphasized.
The strength of our faculty. We have faculty that have years of clinical and research experience. Our faculty are just so down to earth, and they're bringing their experience into the classrooms. They're bringing that experience when they speak to the students and when they speak to their advisees. And I definitely let the students know that our faculty are golden, and that's definitely one of the strengths of the OT program.
Absolutely. I want to ask you a question that I think our listeners are probably asking themselves right now, and that's, where can I apply to NYU? And what additional resources related to NYU occupational therapy would you recommend to our listeners?
Mm-hmm. For the entry-level OTD program, students can apply through the OTCAS and select NYU. For the post-professional programs, students will apply directly to NYU Steinhardt Office of Graduate Admissions. For more information, there's always our website. Yael and I, and actually all of our faculty, are available to meet with students, prospective students, in groups, because we offer monthly information sessions or one-on-one. So they can always email me directly, occupational occupational.therapy@nyu.edu. That's the go-to for any Q&A, and we'll answer your questions quickly.
Like occupational.therapy@nyu.edu. Yeah.
Yael, Janelle, thank you for sharing so many details about your program and the degrees that are offered. I have one final question. I like to end each interview with the Golden Nugget segment and ask you each if you could share one piece of advice or one recommendation with our listeners. What would you say?
I love this question. For me, and that's, I always say to students in our orientation or the first day when they come to school, and also in my last class, never stop learning and always be curious. For me, this is the most important. Don't get things as granted. Ask, be curious about them. This is my advice, very short.
I would tell listeners that your experience is not alone. Don't think what you're going through is just you. Just know that other people may be going through it too. And because of that, I so encourage the resources that are available to them. Fellow students, our faculty members, our administrators, reach out. Let us know what's going on. Don't try to take care of everything by yourself. Know that you have support and there is support for you.
I love that. Those are wonderful golden nuggets, wonderful words of wisdom. Yael, Janelle, thank you again so much for taking the time to speak with me today. It's truly been a pleasure.
Thank you. Thank you for having us.
The most wonderful time of the year. Although, let's be honest, around the holidays, things really add up. But here's the good news. Only at Verizon, you can get a single line for $50 per month when you switch and bring your phone. So, while ice skating for two is definitely costing more, here at Verizon, you can save. Gifts for your third cousins? Steep. A single line with Verizon? Not so steep. A real tree? Pricey. A single line with Verizon? Less pricey. Flights to see Mima and Pops? Those are up. A $50 per month single line? That's down. Even a trip to the Atlanta holiday market will cost you more. But with Verizon, you can switch and bring your phone for just $50 per month for a single line on unlimited welcome, with autopay plus taxes and fees. All this to say, during the holiday season, when everything is costing more, you can get more for less right now at a local Verizon store. $15 monthly promo credits applied over 36 months with a new line on unlimited welcome. In times of congestion, unlimited 5G, 4G LTE may be temporarily slower than other traffic. Domestic data roaming at 2G speeds. Additional terms apply. The most wonderful time of the year. Although, let's be honest, around the holidays, things really add up. But here's the good news. Only at Verizon, you can get a single line for $50 per month when you switch and bring your phone. So, while ice skating for two is definitely costing more, here at Verizon, you can save. Gifts for your third cousins? Steep. A single line with Verizon? Not so steep. A real tree? Pricey. A single line with Verizon? Less pricey. Flights to see Mima and Pops? Those are up. A $50 per month single line? That's down. Even a trip to the Atlanta holiday market will cost you more. But with Verizon, you can switch and bring your phone for just $50 per month for a single line on unlimited welcome, with autopay plus taxes and fees. All this to say, during the holiday season, when everything is costing more, you can get more for less right now at a local Verizon store. $15 monthly promo credits applied over 36 months with a new line on unlimited welcome. In times of congestion, unlimited 5G, 4G LTE may be temporarily slower than other traffic. Domestic data roaming at 2G speeds. Additional terms apply.